Hello, this is Dr. Gay from First Look MRI, and this is a 61-year-old male with complaints of right-sided hip pain and buttock pain. And we have two views here. We have a coronal view of the hip. We see a round ball here. This is the femoral head. We see the neck here, and we see a bony protuberance out here. This is the greater trochanter. And when patients have trochanteric bursitis, almost always it's associated with the gluteus muscle attachments right here on the greater trochanter. So we see fluid or inflammation over here, and these are the gluteus muscles, the butt muscles coming down here and attaching over here, but this looks pristine. There's no fluid or inflammation in the region of the greater trochanter. But there's another bony protuberance down lower and medial. This is the lesser trochanter, and the patient has some really unusual signal over here. We see this dark band or glob. Here's another dark glob. We see this area of brightness and these areas of darkness in the middle, and it looks sort of nodular and strange. So this is really prominent synovitis within a bursa. So there's a potential space here called the lesser trochanteric bursa, and this patient has inflammation of that bursa, and the inflammation is bright with these little nodular areas of darkness throughout it. That means there's really prominent synovial inflammation, and also there are broad bands of this low globular signal that are probably areas of scar tissue within there. So prominent inflammation of that bursa. Now in the axial view, we see the front here. This is the buttock region, the gluteus maximus muscle. This is the femur, and this bone here is the ischium. This bony protuberance is the ischial tuberosity. This looks like an inverted golf tee, and here where it's broad, the hamstring tendon is attached right here. These are the hamstring tendons attaching here. A little bit of fluid, a little blip of brightness there. Again, that fluid means there's a little bit of inflammation of the hamstring tendon on the right and also the hamstring tendon origin on the left. But the main finding is right here, lateral. So the greater trochanter is out here again. The lesser trochanter is right here, this bony protuberance poking out like a thumb. And then along the medial margin, we see this synovial inflammation and scar tissue. And over here we have the iliopsoas muscle complex, and here's a central tendon. The iliopsoas comes down, and that little dark band there, right there, will come down, 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 down. There it is right there. And it's going to attach on the lesser trochanter. You can see the attachment right there. And all this inflammation is along the medial margin, so this is that potential space of the bursa. So inflamed bursa, lesser trochanteric bursitis is a very rare cause of hip pain and buttock pain. We have a muscle here, the quadratus femoris muscle. Sometimes this can be pinched when this gets inflamed and irritated, but I do not see any muscle edema. And this can be related to gout or rheumatoid arthritis or psoriatic arthritis or overuse, prior injury, lots of different things. But again, a very rare thing of lesser trochanteric bursitis. Thank you very much.